University of Florida. We have extension offices in all the 67 counties in Florida. Mine is Manatee County in the Gulf, below Tampa, and above Sarasota, Florida. We have as well a lot of research and education centers that you can see around in the map. And the mission is to develop knowledge in agricultural, human, natural resources, and to make that knowledge accessible to sustain and enhance the quality of human life. In the offices of the University of Florida in extension in every county, we have faculty members. They have expertise in different areas. My area is no agriculture. I want to disclose that. My area is human qualitative and quantitative life and dealing with the individuals. And as you can hear from my accent, I was born and raised in Colombia, South America. So my main language is Spanish, and I disclose information in both languages in the university, primarily. And I teach a lot of minority, and I work with outdoor workers as well with farm workers in campaigns in the county and sometimes around the area as well. The university is an equal opportunity institution, and today we are going to have three mainly objectives. What are the best practices for reducing the flu transmission in farm worker communities? These prevention are based in research. I was telling Carly before come to do the presentation, I was doing research because this is a completely area that I need to have the right information to provide you to that today, and that's the reason. What kind of hygiene and nutrition, what are the tips that an individual can have to prevent the flu season? And it's not only for farm workers, it's for us, for every kind of individual, how we can support our immune system as well. And mainly for this particular population, how we can communicate strategies, how we can share this information effectively with the Spanish-speaking clientele. Something I want to mention in the first session is we need to tailor our strategies based in 4 different pillars. We need to understand this as a diverse cultural beliefs and practice, and these individuals, when they have something in common, sometimes that they speak Spanish, the cultures and beliefs from country to country change. And even though that are speaking Spanish, there are certain dialects between these Spanish speakers. They can come from Mexico, they can come from Guatemala or Honduras. There are native dialects. We need to have an involvement. This is a trusted community. We need to find the leaders they have in every farm, in every field. There are leaders of the community. Those are the ones that we need to get in contact every time that we want to bring a campaign for instruction with them. And this, because we are talking about the flu influenza, the main partner that we count and we have used in several occasions is the health department. Materials. The materials needs to be in multiple language, mainly Spanish. And we need to respect the traditional foods and customs they have. We need to offer as well support. Extensions are programs tailored to the community and the culture that they represent, and we tailor the programs based on those culture. If we are going to see the contest challenge, this group has limited access to healthcare, mainly for transport, insurance. The language barrier is one of the main things as well, and they don't trust institutions. That's something that came from the countries that they are come from. The cultural values emphasize family. Family is the number one thing for all the individuals that are coming from Latin America, Central America, Hispanic speakers, we trust family as the pillar of the foundation. And something as well, collectivism is a group together, everybody empowered together works for one purpose. Why farm workers are a high-risk group? Mainly demographics. There are mostly migrant individuals, seasonal. There are as well living in densely houses, and how they work, reality that they are working with. They are working outdoor, the exposure that they have to the weather, sometimes the long commutes in transportation when they go to the field, and the limited sick leave that they have as well. Is a research that was very interesting when I was doing the presentation. I found that was for the CDC when they captured national level the cases, and for flu, 16% of the cases were in counties when 20% of the population was farm worker. So that's something that we need to start to see as a prospect. For you here, I bring the map from the CDC that has the season of the ending of the 4 week on January 31st, 2026 of influenza. We can see in Florida how we have a moderate to almost high level of influenza. We can see that this year the temperature has dropped severely, and a lot of people is not prepared for that. We are not prepared to have Florida with a lot of cold and sometimes cooling temperatures closing to the 0 degrees, 1 to 3 degrees. So that is something that we are not adjusted. And a lot of individuals have issues with this, and we have more numbers of population getting the disease. The immune system functions begins to decline fairly early in life. Older adults are at higher risk than younger adults for infections from various infectious agents. They are also more likely to develop severe illness when they become sick. This is why you hear about older adults being hospitalized or even dying during major foodborne illness outbreaks. Another cohort that can be severely affected by foodborne illness is infants, because their immune systems haven't fully developed. Adequate intake of protein, vitamin C and E, beta carotene, zinc is needed to help keep the immune system functioning well. This does not mean that supplements are required, but that food intake should include a wide variety of helpful foods. That's something that comes for the instruction that we do to minority groups. We need to come to teach them what kind of food, what kind of products are the ones that contains these values that can enhance their diet and can protect the immune function to prevent flu and influenza. There are different drivers that in agricultural settings. One of those is temperature. Influenza viruses survive longer and cooler temperatures. During late autumn and early winter, the risk of exposure rises. Another factor is humidity. Low humidity dries respiratory mucus, making it easier for viruses to cross the mucosal barrier in humid, warm climates. The virus remains on surface for a shorter time, whereas aerosol stability can be greater. Consequently, the risk profile varies geographically. It depends where you are located. The wind and shade. Outdoor work chills some droplets from direct sunlight. This has the UV reduce the viral viability, but can also carry aerosol farther for the wind. Worker cabins, trailers that are poorly ventilated becomes breeding grounds for contact. Everything needs to be clean, and we are going to be this further. Another thing that amplifies this is the field. The high density activities. Harvesting is one of those. Packaging in tight spaces for example, inside irrigation beds or compressed loading docks, increases the number of close contacts per hour. Shared equipment, tools, tractors, and protective gear are often moved between workers. If not clean, they become fomites. The time of labor. Harvest periods coincide with peak viral circulation. Workers often rise early or stay late, which limits opportunities for rest and immune recovery. When we catch a cold, flu, we take time and the body takes time in recovery. So this is implies with the time of labor. This is the key research findings that is about the influenza. This is something that let's bring the data to the field. The Hugh review reminds that the viral shell is far more stable when the air is dry. So if we go roll out a vaccination push after harvest, we are hitting the virus when it's most vulnerable. When the 2020 study from the Journal of Agricultural Health tells us that a low humidity directly correlates with higher infection rates among those who work under greenhouses or open air fields, that's a cue for us to add simply humidifiers or schedule labor during high humidity mornings. The CDC flu view trimester data shows a distinctive spike about 3 weeks after the harvest peak, when the workforce is exhausted and perhaps less complacent about the health. That's a textbook window for us to bring a mobile clinic into the crop perimeter. Mass studies are clear, consistent with use of slashes household transmission, but nearly half. So what we do on the ground is make mass readable, available, and test fit then on site. Finally, the Rural Health Initiative, RHI, and the University of Florida Extension Study both highlight the impact of mobile outreach and simply is infrastructure improvements such as hand washing stations on compliance and update. And these aren't just incremental, there are evidence-based labors that can be deployed swiftly by extension agent. I want to disclose that this table I found it and I was using with artificial intelligence to gather the information for the presentation. So a prevention strategy. I want to reiterate that agricultural workers are in a monolithic group. Farm labor includes migrant, seasonal, full-time, and part-time workers, all of whom have similar exposure. Emphasize the adults older than 6 months are eligible for the seasonal vaccine. However, clarify that children who travel with families can also be part of the outreach if they are present on the farm. The timing. Explain the vaccine plus immune boost window. Vaccination later in October allows the immune system to mount protection before the cold, dry months strengthen the virus. For staff who only start after harvest, schedule a post-harvest inoculation 3 weeks after picking. This is information that has been research data for the compiled that I was showed to you in the table, in the slides that I showed before. Something that we need to mention is hygiene and surface cleaning. We need to instruct to teach how is prevention executed. So one of those methods is put hand wash stations, portable pumps with soap and loading docks in eating areas. How long we need to wash, how well we need to wash the hands between the fingers, under the nails. That's something that we, as instructors, we mention to the clientele. So that's the reason that we are your partners in this strategy to bring that to the field. Disinfectants, 70% of alcohol wipes for tool chains and chair benches. Everything needs to be clean when somebody's going to use it to try to spread the disease to another individuals. A routine needs to be established. A 5-minute wash every shift after returning for the field. That's something that we explain when we are having is individuals. We explain what is happening, why we are doing it, what are the advantage, what we are gaining. So this community needs to learn all this because in certain countries where they are come from, they have never received this instruction. We are instructors to them in all these steps. Personal protective equipment, mask, N95, gloves, a protection for pesticide exposed workers. Those are the items that we can use and everyone's using the farms to prevent the spreading of diseases. The environmental controls, ventilation of temporary housing, and regular cleaning of shared tools. That's something that needs to be daily, and the farms and agricultures have this for cross contamination very, very, very well enhanced. For the individuals, to prevention of disease is something that we need to start to teach and give them the steps to execute and put in place in every area that they are familiar how with this process. Something as well is in housing and environmental controls. We need to schedule in the field airing the tents during the harvest, the ventilation periodic for the temporary cabins, and use of window fans. During the winter, it's recommendable as well to open the windows and let the wind goes inside of the houses to ventilation as well. Serious case, install a simple bus fan with an exhaust outside, and there are certain tips of climate control. They can help with mobile heaters and cooling during the winter as well, be in place in the area. If we are talking about what we can do to prevent, as a every individual to prevent to have flu, influenzas, the beta carotene is found in plant foods such as sweet potatoes. That's something that I motivate you to start to eating during these months to try to be prevention of influenza, as well as potatoes, spinach, carrots, mango, broccoli, and tomatoes. Those are the products that have high percentage of beta carotene and vitamin C. Rich foods include citrus fruits, berries, melons, tomatoes, bell peppers, broccoli. Vitamin D is found in fatty fish and eggs, milk, and 100% juices that are fortified with vitamin D and are also sources of important nutrient. Zinc is more readily absorbed from animal sources such as beef and seafood, but is also present in vegetarian sources including wheat germ, beans, nuts, and tofu. Probi- a lot of individuals consume probiotics, and there are good bacteria that promote health. They can be found in cultured dairy products such as yogurt with live cultures and may also be present in other fermented foods such as kimchi. Protein comes from both animal and plant-based sources such as milk, yogurt, eggs, beef, chicken, seafood, tofu, nuts, seeds, beans, and lentils. These are the kind of products that are going to support the immune system for disease and viral contamination. These are the main that we need to start to consume. Something that we need to help to keep is the immune system healthy all year long. And we need to focus on a balanced eating plan, adequate sleep, and stress management. Adults should aim to 4 to 7 servings of vegetables and fruits daily to get a variety of vitamins, minerals, and antioxidants that may support immune health. Good hygiene and hand washing help prevent the spread of germs. Remember to wash the produce and the running water before eating or using it in recipes, even if you don't plan to use the peel. Clean glasses, fork, spoons, and other utensils to reduce the spread and growth of bacteria. Find healthy and appropriate ways to cope with the stress, such as meditation, listening to music, or writing. Physical activity is also a great way to help to manage stress and may help reduce the risk of some chronic diseases that could weaken your immune system further. The lack of sleep contributes to a variety of health concerns, such as weakening of the immune system. 7 to 9 hours is recommended per day for adults, and children aged 1 or older require 8 to 14 hours depending on the age. This is something that we need to instruct and teach to the farm workers because they don't have access to this kind of information. So that is very good to partner with extension that an individual comes to this instruction in this area. Family and consumer science agents, we do this instruction. Hygiene and nutrition. Of course, the farms, they establish hand washing protocols. They have a point use of sanitizer. Simple, affordable diet boosters sometimes pass around citrus vitamin rich foods and emphasize the sleep and the hygiene before sleep is going to sleep or going to start to working. That is important to reinforce us with them. Something I want to mention is that in the composition of water that decrease in the body and that decrease with aging. As a comparison of an infant's body is about 75% of water. In the body of an older person is about 50% of water. Because of this decrease in the body water, older adults are at increased risk of dehydration and should keep themselves adequately hydrated. When we are working in the field, when we are outside, we should be drinking every 15 minutes water, but it's very difficult to stop the work that we are doing and come back to drink. But the shifts, the breaks, the work should be drinking water. Because of this, the thirst mechanism can affect by aging. Adequate water intake can be challenging for some older adults. That's something that we need to do. The water stations that are in the field, there are great way to do this to help them with the thirst on the field because of the temperature and the hard work, labor they are doing daily. Why use extension as an outreach? Extension needs to collaborate with farm manager and work advocates to bring any kind of instruction on the field in campaigns to prevention of flu, in any kind of campaign of health wellness. Creating culturally appropriate brochures and digital content. Everything needs to be distributed to them in the language that they speak. And the individuals providing the instruction should be individuals speaking the language. So that's the reason that collaborating and have these community partners help us to enhance the instruction. Something is the leveraging of mobile health units and seasonal clinics. The health department has this, and as well the rural health. Doing partnerships to bring the instruction to the farm in the areas that the farm workers are is the best option. During the year, these organizations as well have planned health wellness first that are bringing sometimes to head starts areas that are bringing to the fields and they provide health wellness to the farm workers and the families. Those are the leverage that we need to use to provide this instruction to them, mainly to prevention of diseases, uh, what can help them in hygiene, drinking, food intake, anything of these campaigns need to be leveraged with this. And the health department has the mobile health units that bring those to the fields and these campaigns to help this to promote the instruction. Another thing that has been well success with a couple of farms here that I have seen in Manatee County is the peer educators. They have leaders that are the same workers that among them that are helping and that are bringing the information when they are during their tasks. One of the main things is gain trust. How we do this? Building long-term relationships. The individuals they see, they need to come back frequently to the farms because it's not only what campaign and no return to the same area in 1 year or 2 years. This needs to be regularly. Workers sometimes are familiar with the faces they can see. So if they see a familiar faces, they are more opening to the trust. A consistent follow-up with them is mainly priority because there are things that needs to be reinforced more than 1, 3, 4, 5, 10 times sometimes that needs to be consistent. It's the way that they trust the bill over the seasons for the kind of information they're receiving and way they that. So this is building with trust and over time. With working with growers, there are the mainly one purpose to do is offer on-site education. We can not disrupt the weeks and time that the work is done, but there are certain days and there are training that could be done as well after they terminate to work or during the weekend. And that is the best way, and that's bringing this education on site, not making them go to a different area to receive the education. The FRAME initiative is productivity and safety support for the growers. So they want to have healthy individuals working with them in the field because if they have a big percentage of disease in between the employees, that doesn't going to be production and doesn't going to be safety as well. Something that we need to emphasize is the reduction of injury and acceptism. So if the individual knows how the rules of hygiene, how the rules of the cleaning, safety, complaints, everything as well, all these decrease substantially. What contributes to the well-being for how we do outreach is the partners. The Migrant Clinicians Network and the National Center for Farmworker Health was a organization that Dr. Paul from Gainesville mentioned that are mainly working with the farms because he's going to do the work in the farms and we need to work with them constantly and tight. The Department of Health, as I mentioned before, they have a lot of campaigns. We can establish campaigns with them and utilize the instruction in on site. The rural health networks, there are clinicians, there are red of networks, the work and partnership with them to go to do this instruction is a fundamental piece that we need to utilize when we are doing outreach of farm worker community. Because remember, there is a community that they need to receive instruction in all this area, and it depends of the amount of employees they have. Everybody needs to receive this instruction. The sources I use in the presentation are here, and I already want to emphasize with you hand washing stations, the cleaning and hygiene of the tools, and the hygiene of the individuals when they finish to work and before going to work is mainly substantial to prevent the spreading of flu in the field. Thank you. Carly?
Sorry, I was on mute. Thank you so much, Nelly, for that presentation. Again, if you have any questions, go ahead and drop that in the Q&A. That's towards the bottom of Zoom. And we also have an evaluation that we welcome you all to take. It will be forwarded to you after the presentation ends, and you'll also receive a link to the recording if you would like to share it with any of your stakeholders. Thank you so much for attending, everyone.
Thank you.